The annual Walk for Sickle Cell Disease will take place Saturday at Franklin Park. The event sponsored by the Greater Boston Sickle Cell Disease Association. To tell us about the event are the association's executive director, Jacqueline Haley, and a board member with the Infusion Center at Brigham and Women's Hospital, Dr. Maureen Okam. Thank you both very much for being with us.
Thank you for having us.
I want to start with Jackie. First of all, you've got two purposes really behind this event. That you got the research part, but you also have the awareness. Talk about the awareness part of this.
So the organization's Greater Boston Sickle Cell Disease Association came about because basically there was no awareness in the community about sickle cell disease, and so our families had not a lot of services available to them, and not a lot of people knew about sickle cell disease. So the organization was created to meet this need. So we go out and we work with local community-based organizations. We work with families to raise awareness.
And Doctor, what about the awareness, why it's important for health reasons to know things at an early stage?
Yeah, so sickle cell disease is a genetic disorder, so people are born with the disease, and it's a disease that you have for your life, the length of your life. It can be debilitating from time to time, so it's important for not only yourself, but people you interact with to know that you may face some challenges that are short-term, but may impact your work or school. The Greater Boston Sickle Cell Disease Association has done a great job in increasing the awareness of the community, not only for people who have the disease, but for their siblings and other family members who may carry the gene themselves and may transmit it to an offspring. And so this impacts or should impact who you choose as your partner to have children with. And if you do have a child who has sickle cell disease, then you know how to manage it. It's primarily managed by prevention. There are some treatments, but prevention of these acute complications go a long way to ensuring a better quality of life. So we think awareness is really important, and we embrace any opportunity that there is to increase the awareness.
Jackie, it seems that one of your concerns here is just is access to care for people, right?
Right. For our clients or our members, most of them are either low income that we currently serve, and so they face challenges in really gaining access to care. We must say that Boston is really great with access, but we do have clients who, because of whatever social issues may be affecting the family, may not be able to get their care.
Right. We're talking with Jacqueline Haley and Dr. Maureen Okam. Doctor, what about the research that's going on here? Is there any hope for some better way to respond to this condition?
So right now there's only one drug that's FDA approved for sickle cell disease, and that's hydroxyurea. It helps reduce the acute complications of the disease, but in itself it's not a cure. So there is a lot of research going on to better serve this community with things that help with complications, but also cures. The only thing right now that is a cure for sickle cell disease is bone marrow transplant. And that's a rather complicated procedure, and so we pick and choose carefully patients who qualify and will do well getting a bone marrow transplant. Short of getting a bone marrow transplant, there are many compounds that are currently under investigation, and so we try to encourage patients to get involved in clinical trials, because that's how we move that's how we move the field forward. We are quite hopeful that many things that are in trials now will be beneficial for our patients with sickle cell disease.
Jackie, what's also interesting here is you need awareness, because people could feel just fine and not realize that they have the gene for this disease.
Right. For those who may be born 20 years ago in the U.S., we have newborn screening. So these children are adults now, may be aware. For those who were born prior to the 20 years, or what year? Prior to this,
if they were born
prior to
that,
then
right.
they may have not know that they have the trait. So it's very important for everyone to know that they have the trait, especially, and we have those who may have come from the Caribbean as well, who may not know that they have the trait. And so in selecting a partner, they need to know when they're ready to have children that they have the trait. Because it's 25% chance of having a child with sickle cell disease if you have a baby with someone else who has a trait.
Right, right. Doctor, what about your decision to specialize in this field in your work? What drew you to that?
I think what drew me to, so I practice hematology more so than I do oncology, but I am trained in both. And what really drew me to both specialties is how far we are from being able to manage the disease perfectly, if I may say perfectly. Sickle's, what I find most intriguing about sickle cell disease is the heterogeneity in symptoms. So there are people with sickle cell disease, usually the milder phenotype, who are first diagnosed in pregnancy, for instance. So this is an adult woman who had no idea she had the disease, and yet there are other patients who are in the hospital 4 to 5 times a year, every single year. And unfortunately, all we can do in the hospital now is give fluids for hydration and give pain medication. We have not gotten to a place where we can target what exactly is causing the pain. You can see that this is then a very complicated issue now with the narcotic problem we have in the country. So I find it, I hope that I am one vessel of many that will get us closer to therapies that will significantly impact the disease, but we really need many hands on board. I decided to be one of them.
Jackie, the doctor made clear there's a long way to go with sickle cell anemia. So talk about the next steps at this walk.
So on Saturday, September 17th, we are hosting our walk and our sickle celebration in the park. And the event is really to bring the community together to support these families, or to show these families that they are supported. It's also as well to raise awareness of the disease and to raise funds, most importantly, for the organizations. And these funds actually fund our programs and services, because the organization is a volunteer-run organization, so we don't pay staff. So the monies go towards programs and services and maybe small overheads.
And what time is this going to be happening?
So the kickoff, the registration is at 9. Kickoff for the walk is at 10 o'clock. And then after the walk, we have wonderful events lined up. We have a multicultural concert. We have a health fair. The family van will be doing free health screening. We have a dental group that will be doing free teeth cleaning for children. We have face painting, Spark Art Mobile from Mass Art will be there. So we really have a great family fun affair that day.
And in which part of the park should people be looking for this?
So we are in Franklin Park, across from the Lemuel Shattuck Hospital, close to the tennis courts.
Right. Well, thank you. And you've got a website too.
And we have a website. So for more information, they could visit www.gbscda.org, or they can call us at 617-825-4595.
All right. Well, thank you both very much, Jacqueline Haley and Dr. Maureen Okam.
Thank you.
Thank you very much.